Hi, Hayen. So replying to your discussion post, uh, I I agree with you with the whole bargaining thing. There is a fine line in when it comes to bargaining with patients. You don't want as healthcare staff to be taken advantage of and definitely doing things that are out of your scope or that's not safe or that puts the healthcare provider in a dangerous situation by doing things they're not supposed to do. Um It can, if done in a certain way that both patient and their care can be uh done in a safe way, then yes, bargaining, like for instance in our work, where I work, we do bargain. Like if we want to do a certain test, patients want this. Well, if you let me swab you and we can roll this out, then the next step would be that. So like you'd have to do a little give and take. Um, and then that's an example of how bargaining can be useful, but yes, to a certain degree. Where I work, it's not an inpatient, I work at an urgent care, so we only see you for that day and for that thing, and then you're out. I've seen where bargainings have gone bad, where it does do a delay of care. Some providers, recommend to go to the ER, but the patient's very adamant they don't want to go. So then the provider will be like, well, let me run this test on you, and if whatever they come out, then if it's showing more direction towards ER, will that further convince you to go to ER? But by then, we've done all these tests A, B, and C, when they could have been at the ER by now, getting their care done that was needed in the first place. But because the patient didn't want to go, didn't feel convinced to go, we had to do these tests, which delayed their care. And in instances like that, I can see where bargaining is a bad idea. Um, with the patient preferences and stuff, we in hearing them out, like you were mentioning earlier, we do that, like to a certain degree. So like we have females coming in with female problems and they just so happen to get pulled in a male provider's room. We always do ask, like, do you mind being seen by a male provider for your issue today? And if they're not, if there's a female provider available, we give them that option. They do sometimes have to wait longer. Excuse me, if that female provider is busy, but it is what it is. If you want this, this kind of what happens. So for the most part, they're agreeable if they're really adamant seeing a female provider, or if a male wants to see a male provider if they're available. But we do give them that notice when they come in the room for certain issues that they're coming in, that hey, this is what's happening. We only have male providers today, or we only have female providers today, or we have a full female staff because we don't have a lot of MA male MAs or male nurses at our clinic. So it's like, hey, this is what's going on. Do you still want to be seen? Is that okay with you? And so in that bargaining and that sense of uh, giving the patient their preferences, when applicable, when available. Um, we go through that at work too, where I work at our clinic also. Um, in my post, I did mention about communication, how that's a big key. But you did make a good point that the communication during the collaboration was discussion. There was lack of that, and that's why Mr. Johns had another fall, which I did forget about that. Yeah, there should have been more better communication between staff and handing off, so that could have possibly prevented the falls that happened afterwards. So I think that's a good point that you made, that communication between, not only between staff and or provider and patient, but between staff members is very important in ensuring patient safety. So I agree with you.